VCU Health System plays a very special role for the citizens of Virginia, the Commonwealth of Virginia, and frankly all citizens in the Mid-Atlantic region. We are Central Virginia's only comprehensive academic health science center, and as such we provide state-of-the-art clinical care across the full array of medical specialties. We provide state-of-the-art teaching opportunities for the full continuum of medical and allied health professionals, and we are a research institution in that we provide the output of cutting-edge research to the nation and to the world. In that capacity, we have a number of other specialty programs as well, one of which is the Center for Human-Animal Interaction. The goal of the center is to discover the full positive impact of having human-animal interaction being part of a clinical environment. At a patient care level, having the animals in the environment brings tremendous comfort to our patients. It brings a warmth, a wonderful set of interactions to the clinical environment that I think clearly does have healing benefits to our patients.
Nothing is more natural in the world than dogs and kids. They just go together like peanut butter and jelly. When we bring a dog into this environment, we don't have to explain to the kid what it's about. We don't have to say why the dog is here. We just say, we have a dog, do you want to see it? And they say yes. And then this environment becomes a place where fun stuff happens and cool stuff happens. And when kids are feeling more calm about things and they feel like they have can master this experience rather than be the victim of it, they are going to heal better. When they're emotionally competent in this environment and feel like they have a role in what's going on, they're going to heal better. And the dogs accomplish that because it helps kids feel normal and like themselves, when a lot of what goes on here makes them feel like this is not their life and how can this be happening to them. Dogs just make kids feel okay, even when everything else is not okay.
I'm the only person who walks in and doesn't want something from them. I'm not taking their temperature, I'm not asking them anything. If they want to play with the dog, they can. If they just want to sit and pat it, if they don't want to see it at all, that's okay with me. We're allowed into ICU, so we had a patient who progressed into ICU, and we spent a lot of time with the patient and the family, and when we actually lost that child, the family asked that Rocky sit with the family at the funeral services. And so you know that you've meant something to those people, and you've been with them for months, day in and day out, in some of the hardest times of their life. And it's such an honor. The parents are just amazing. But as you can see, it really gets to me sometimes.
We have found in our research here at VCU that patients' fear reduces after very brief interactions, maybe 15 minutes with a dog before a serious medical procedure. We found that our patients' anxiety levels reduce. We know from other studies that depression's reduced in patients. We've also found the benefit for our staff in that their stress hormone, cortisol, significantly reduces after only 5 minutes with a therapy dog. So we know that it's not just our patients that are benefiting, but also our staff. So we're now looking at different things like brain waves to see what happens in the brain when people interact with their therapy dogs. And we're also starting to look at patients undergoing dialysis and to see what benefit they may have from interacting with dogs during that long process of undergoing dialysis.
Oh, I love these guys. You need to come up here.
Life gets to be a little hectic around here, and people come in with various serious psychiatric disorders, depression, anxiety, and we find that in addition to our standard treatments like medication and psychotherapy or talk therapy, something like AAT or animal-assisted therapy is a very good auxiliary treatment. In the patient context, when we have someone who is depressed or anxious or even sometimes psychotic, that is, their reality testing is impaired, having an animal visit them and having them kind of pet the dog, interact with the dog for a few minutes, maybe 15 minutes, maybe half an hour, comes in very useful, reduces stress levels, improves communication, improves behavior, helps the treatment team engage the patient better in treatment. In the ECT context, like electroconvulsive therapy, it is a procedure for serious depression and for a condition called catatonia. But of course, waiting for ECT is an anxiety-provoking time. And interacting with an animal rather than just waiting in the standard waiting room reading magazines, we have found can reduce pre-procedure anxiety tremendously. There has been a study that demonstrated that at this medical center.
I think it's great. Anything that makes patients feel better and more comfortable is a good thing. So I'm all for this. I think they do a great job. These dogs are just great. They're well trained. They don't cause troubles, and the patients love them. So I think it's great.
To walk through a very busy cardiac surgery ICU, these are post-op patients after heart surgery, and to see a precious soul who's been through an incredible event, the arms come outstretched. They don't even know what it's about. They just see the furry creature. Can they come? And to see how these dogs interact with the patients, it's incredible to me. We've had patients sometimes who haven't responded to anything else, and just having the dog and being able to stroke the dog, to see a smile come when you haven't seen one for several days, or to see a glint in a patient's eyes when you haven't seen that for several days is really pretty incredible.
It's just, it's hard to relay in words the kind of effect you feel when you've seen a dog in action. You know you've made a difference. It might be small, but you see the difference in their faces. And you know that when that dog entered the room, they weren't asking anything of anyone. Here's a person who nurses mean well, the doctors are there for them, they're trying to get better. The family's there for them, but they all want something out of this person. The dog comes in, it's visible, relaxation, it's visible, the difference that happens in just a few minutes. It's, you just stand back and watch it happen. It's something a person cannot do. A person cannot do it.